Everyone, so today I'll be discussing about the measures that we can take to slow down the progression of chronic kidney disease. So I'll be mentioning or labeling this topic as measures measures to slow down CKD progression. So these are just basic, or I would say the general measures that one patient of chronic kidney disease can take, irrespective of whatever disease he may be having, to slow down the progression and to slow down the pace at which he lands up in dialysis. So first of all, he should try to maintain an optimum BMI. So basically, the BMI should be optimum. The BMI should be optimum. It should be around 20 to 25 kilogram per meter square, so that obesity does not lead to more further complications. Number two, if he's smoking, so definitely smoking cessation is advised. Number three, alcohol reduction. Definitely alcohol should also be curtailed. If alcohol intake is not curtailed, then he may land up in more problems, so alcohol intake should be decreased, definitely. Now, next, patients who are living a very sedentary lifestyle should try to exercise at least 5 times a week. Exercise 5 times a week with 30 to 60 minutes of moderate or high intensity aerobic activity. Correct? Now, going on more further, I would say that when it comes to medications, then what medications should we take? So definitely, when we come to medications, the first and the most important that you would have heard in the case of nephrology are anti-proteinuric medications. So basically, we use ACE inhibitors or ARBs to decrease protein excretion in urine, which are nephrotoxic. So therefore, they decrease protein excretion, and these are most important for people in whom the protein excretion is more than 300 milligrams per day. Then we should try to manage BP as well. So BP management is very important. BP management should be done, and usually the target BP is 130/80 for patients who are having proteinuria as well, proteinuric CKD, and or patients who are having diabetic CKD. And patients who don't have diabetes, or who don't have proteinuria, they can have a slightly modest cutoff of 140 millimeter 140/80 millimeters of mercury as the optimal BP cutoff. Then as far as the hyperlipidemia management is concerned, hyperlipidemia should be managed with statins, and statins should be recommended for all patients who are in G1 to G5 stage and more than 50 years of age. And we usually adopt a fire and forget policy. Fire and forget policy means we do not monitor the patients as per the lipid levels that they have. We usually just start the lipids, which we usually use atorvastatin, and then we just don't monitor on the basis of lipid levels, actually, because the basic pathophysiology of heart disease in CKD is not just based on the high lipid levels. So therefore, apart from atorvastatin, we just initiate and then we forget. Number four, definitely will also, if patient is diabetic, then we will use anti-diabetic medications depending on the GFR that the patient is having, and we should also use SGLT2 inhibitors at least in G1 to G4 stage, because they are found to have both renal and cardioprotective actions. Now, apart from this, salt reduction should definitely be done. So usually it is recommended that less than 2 gram of salt should be taken. Okay? Less than 90 millimole of sodium. Apart from that, fluid restriction is needed, but that's not for CKD progression. So apart from this, I think most of the things have been covered. Apart from that, we should definitely have a good and regular physician follow up, so that any complications or any untoward effects can be noted and corrected. So thank you very much. I hope this was of help.